these are generally probably thoughts held by doctors when they're looking at diagnosis. Misconceptions that the child's epilepsy isn't severe enough early on. They haven't had enough seizures to make a diagnosis. And I think along with that, misconceptions that talking through why you might look into this as a diagnosis would be a challenge for a family, when in reality families are already searching. So I had a family not long ago who I met who hadn't got a diagnosis at that time, and I talked through and thought, although the presentation was a little bit unusual, I thought this probably was going to be Dravet. And I mentioned that to them and talked about that, and they nodded, and I said, had you come across this before? And they said, yes, we'd done our research. And again, even though this wasn't necessarily the most likely at that time, I thought it was something really important to exclude, and that turned out to be the diagnosis. And that meant that that family had already come with a lot of questions about the future, including difficult questions around mortality, difficult questions around overall outcomes for their child in the future. So I think, you know, the idea that you should put off making the diagnosis and that you might somehow be protecting families is a big misconception.